Hi there, you're welcome to the RX Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit that like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube channel. Also, as a subscription gift to you, we would like for you to download a free meal recipe that we do have here at RX Care. So go ahead and click on the link down below in order to be able to download or view that. Thank you so much for watching and stay tuned. Alright, so what is our medication of choice today? The medication of choice today is known as Venlaflaxine. So Venlaflaxine is also known as a brand name called Effexor. So what is Venlaflaxine for? So Venlaflaxine is used for mental conditions such as social phobia. It can be used for OCD. It can be used for depression, migraine, PTSD, any premenstrual dysphoric disorder. This medication can be used for it as well. Also, in patients going through menopause, this medication can be used to prevent hot sweats. Also, this medication can be used in patients who are having neuropathy due to diabetes, as well as any tension, headache, or just a generalized anxiety disorder. So these are all, or most of the these are most of the conditions that this medication is able to help us treat. So depending on how the doctor described the medication or prescribed the medication to you, this medication may be beneficial to you in terms of that condition. All right, so this medication does come in a capsule and it also comes in a tablet as well. So in patients that are taking this medication, the medication dose ranges between 37.5 up until 150 milligram tablet. Also, some patients may find themselves taking higher doses such as the 225 milligram or the 375 milligram tablet, depending on what the doctor is treating, as well as depending on how well the patient is responding to this medication. The doctor is able to increase the dose in order to benefit the patient. All right, so what are some of the side effects of this medication? So some of the side effects of this medication include dry mouth. This medication can also cause insomnia as well as constipation. It can cause nausea as well as loss of weight. It can also cause loss of appetite in patient, and some patients have reported sleepiness or unusual drowsiness when it comes to this medication. So one thing you definitely want to make sure that you're doing is making sure that you're knowing the side effect of this medication after a couple of days of using this medication before taking the medication and operating any machinery that might require for you to be mentally alert, knowing that this medication can cause drowsiness as well as sleepiness. All right, so what are the serious side effects that you definitely want to look out for while you're on this medication? So some serious side effects of this medication include high pain. If you start noticing any vision changes or any halo around lights, you definitely want to make sure that you're reaching out to your provider. That way they can evaluate and make sure that this is not a side effect or this is a side effect from the medication, and that way they can either stop the medication, reduce the dose, or substitute the medication for another medication in that same therapeutic class. All right, so with this medication, if you start noticing any fast or pounding heartbeat, make sure that you're reporting that to your doctor. Also, if you start noticing any dizziness or concentration problems or memory issues, if you start noticing any loss of sexual ability or desires or performance, or if you start noticing any delayed or inability to have an orgasm, or any erection that is longer than normal, then you definitely want to make sure that you're reaching out to your prescriber regarding that. That way they can evaluate the medication, as I said earlier. Also, with this medication, you want to make sure that you're watching out for any seizures, any unusual behavior, or any thoughts of suicidal thoughts of hurting oneself or another. Make sure that you're reporting that to the doctor. That way they can evaluate and make sure that this medication is still appropriate for you. So what do you want to know while taking this medication? So this medication is best taken with food. Also, in terms of this medication, it comes in an extended release tablet, which you do not want to crush, break, or chew. So you want to swallow the whole tablet with a full glass of water. All right, and in terms of your symptoms for that mental disorder or whatever condition that the doctor prescribed this medication for, if you notice any worsen of that symptoms, make sure that you're reaching out to your prescriber. That way they're able to assess and make sure that this medication is working as prescribed, or if this medication will need to be substituted for another medication. All right, I hope I was able to help in terms of what to look out for while taking Venlaflaxine. Make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content.